So I just met with my surgeon and my doctor, and I'm feeling a little discouraged. The surgery is being highly recommended because if my cancer does come back, which there's still a chance, it'll be stage 4 and it'll be a lot harder to treat. And if I decide to do the surgery, then I have to decide whether I'm going to be flat on one side or if I do both. If I do one side, it's about a 3 to 5 hour surgery. If I do both, it's doubling that time. With my cancer being stage 2 as of right now, it's being recommended that a lumpectomy will be ineffective. And to ensure that it doesn't come back at stage 4, she's recommending that surgery. I don't know if I'm going to do the Ann Arbor surgery. I'm still on the fence with that. But I did find out that, the radiation will be 4 to 6 weeks following surgery. The surgery right now is slated for August 5th. And then radiation would start 3 to 4 weeks after that. And then I did find out that I will have to do treatment for the HER-positive part of my cancer diagnosis for the next year. So every 3 weeks, I still have to go to the infusion center for at least 2 hours, which means that my port is going to be in for a year. And I did not know that going into this, so that's really disheartening because the port hurts, it's bulky, and I thought that when chemo was done, I was done with infusions. And so to hear that I still have a year of doing some kind of an infusion sucks. But, I also want to be here. So it's just a lot. The good news is I had treatment number 4 today. I only have 2 left after this. And then obviously I'll do the HER-positive treatment. But I'm ready to be done. This has been a lot. I have really, really good days. Really good days. And then I have some really bad days. But I'm ready to have my hair back. I'm ready to be normal. But I'm struggling because I feel like with me doing these treatments continuously, especially for the HER-positive, I'm still going to feel like a cancer patient because I'm being treated for cancer. So I was really hoping that going into the fall and the new year, I could start clean and not have the cancer hanging over my head like it has been. And I feel like it has been for the last 6 years. And I think I'm kind of at a point in my life where it has occurred to me that I might always be a cancer patient as far as treatment and having to do all these things for so long. And before I was meeting with my oncologist every 6 months, but now it's every 3 because of the stage. And when I say stage, right now it's stage 2. There could be a chance it's stage 3 depending on when she gets in there. She is going to be removing several lymph nodes from both sides. But the other thing that really is kind of a tough pill to swallow is that they do a dye test. And so they inject this dye next to your nipple, my nipple, and they want to see where it spreads. But because I've already had a mastectomy, that dye test is probably going to fail. Now, if that fails, I have to do a different procedure that pulls upwards of 20 lymph nodes from each side. And when you remove a lot of lymph nodes, that has the increased risk of experiencing lymphedema. And that risk is now 20% to 30% versus less than 2% if the dye test worked. So that kind of stinks. But if the cancer has spread further, then that would increase the stage. But it really stinks because I don't want to do this big surgery. I don't want to have to remove everything. But I also don't want it to come back as stage 4. And originally she was calling this a cancer reoccurrence, and now she's telling me that it is a new cancer because before it was stage 0 because it was in situ. So a lot of information today. And there's good stuff, but I'm still kind of feeling really defeated and overwhelmed and ready for this journey to be over. And I know that there are people that have it much, much worse than me. And I recognize that, and I'm praying for them, and it sucks, but this is the second time I've gone through this. And again, not to the extent, but twice in 6 years is a lot, and I'm ready to be normal. I'm ready for things to go back to normal. I mean, those that follow me on Facebook know that Beckett's really struggling. He is convinced that he's losing his hair. He was even pulling his hair out, and we have him in counseling, and Braxton has his good and bad days, and so I know that's impacting my family. I know it's impacting Jason. He's had to step up and do a lot more, and we're in the thick of it, and I want to help take that burden off of them, but I can't until I'm better, and I'm not going to be better for a while. And it sucks for me, and it sucks for them, and it sucks for all those that have been helping. And so I know it's kind of a rambling message, but a lot of information. I was with her for an hour today. The cancer's shrinking, which is good. So we're going to keep doing what we're doing, and again, finish these last 2 cycles and then go from there. So as of right now, my surgery is slated for August 5th. And then we will go from there. So I will keep you guys posted, and please continue to keep myself and my family in your prayers as we continue to navigate cancer journey number 2. Thanks, everybody.